Welcome to NurseEdScholar. So today we're going to talk about the PPE sequence and kind of run through some NCLEX questions. And so, a lot of students, and hopefully you will not be that student, memorize the PPE sequence, so personal protective equipment sequence, and then I don't want you to get to an exam and you're like, oh my God, I don't remember anything. Do I take the goggles off first? Do I take the gown off first? And then sometimes some students may say, well, why does any of this really matter? Okay. But that right there is the problem because most nursing students try to memorize PPE without really understanding contamination. But today, I'm going to teach you how contamination actually spreads in the hospital, in the healthcare setting. And yeah, I guess PPE and the sequence of it can finally make sense. Because, remember, PPE is not random. Every step is designed around preventing microorganisms from moving from the patient to the nurse, to the environment, and to other patients. And once you really understand contamination flow, you can answer almost any infection question, that the NCLEX or your faculty will give you. So in this lesson, we are going to talk about donning PPE, doffing PPE, contaminated, clean areas, sterile versus medical asepsis, some hand hygiene, um, uh, I don't know, some NCLEX traps, because infection and contamination and PPE, it's everywhere. You're going to be tested on it in your fundamentals, Med-Surg, um, clinicals. They're going to ask you about it. You'll see this kind of stuff if you're using ATI to study or HESI, and then you'll see it on the NextGen NCLEX. So you really need to have a handle on PPE. Okay, so let's kind of break this down. Okay, so before we talk about PPE, you have to understand contamination and contamination zones because infection control is all about the movement of microorganisms. They can move through touch, they can move through droplets, respiratory droplets, they can be on surfaces, it can be on bodily fluids, and then, of course, it could be in the air. But here's the critical concept. Once a contaminated surface touches a clean surface, then that clean surface becomes contaminated. And that is the entire reason why PPE sequence matters. Think about it. You're in the hospital. When a patient coughs or when they sneeze, if they're bleeding, or even have wound drainage, microorganisms are leaving the body. And these microorganisms can survive on the bed rails, the IV pumps, your gloves, your stethoscope, your phone, even your ID badge. And remember, some organisms, they may survive for hours, they may survive for days. So think about it like MRSA. MRSA can survive on surfaces. C. difficile, those spores can survive extremely well in the environment. So for you as a future nurse, you know, your job is not only to avoid becoming infected, you as the nurse must also prevent actually becoming a transport system for microorganisms. And that's really important. You're going to have to think about uh, PPE isn't really about self protection only, but it's about infection control and it's about protecting, other patients. It's protecting your immunocompromised patients. It's about protecting your coworkers and the healthcare environment. So let's talk a little bit about medical asepsis and sterile technique, because this is really tested a lot. And, students kind of mix this up. Okay. So when you're looking at medical asepsis, It really means reducing the microorganisms in the environment, right? Not eliminating them completely. So examples of this is wearing gloves, uh, hand hygiene, um, routine cleaning of the environment, and isolation precautions because you're reducing the amount of organisms in the area. But when you talk about sterile asepsis or sterile technique, you'll hear sterile technique a lot. It means that no microorganisms are present, and it's much stricter. So examples of this is like, when the provider is putting in a central line, if they're inserting a central line, that's going to be sterile. Surgery is sterile. Putting in a urinary catheter, inserting a catheter, that's a sterile technique. And then sterile dressing changes. So sterile asepsis or sterile technique actually means no microorganisms are present. Okay, so understanding that distinction really matters physiologically because different procedures carry different infection risks. So, for example, touching intact skin, so you don't have any abrasions, you don't have any lacerations or anything, is at lower risk. But when you're performing an insertion of a catheter, you're going directly in the bladder, bypassing all of the body's natural defense systems. And so now microorganisms, if the catheter isn't contaminated, it can enter the sterile body system directly. Okay. And this will dramatically increase infection risk. So, when you hear your instructor saying, "Oh, you contaminated the sterile field, you got to start over." That's why, because it's supposed to be sterile, no microorganisms present, because you don't want to insert microorganisms in a sterile body system. And that's why, in the hospital, you'll hear about qualities, and I'll talk about that in a minute. Okay, so let's look at a question. Um, the nurse prepares to insert a urinary catheter. Which action requires intervention? Using sterile gloves, maintaining a sterile field, touching the sterile catheter with your bare hands, or opening supplies away from the body. And if you said C, touching the sterile catheter, with your bare hands. Remember that touching it with your bare hands contaminates it immediately. And that's because the hands naturally contain microorganisms. Even after hand washing, you still have normal skin flora that's present. So when our bare hands touch a sterile catheter, microorganisms transfer onto that catheter surface. And then now we're introducing the catheter into the bladder. And so that bacteria is bypassing the body's normal protective barriers. And this can lead to what's called a catheter associated urinary tract infection. And in the hospital, you'll hear it as a CAUTI. NCLEX wants you to think, did contamination occur in this procedure? Okay, so let's get down to the dawning sequence. So dawning means putting on. So correct dawning sequence is correctly putting on the PPE. And the order matters because you're kind of building layers of protection. Okay. So first and always perform hand hygiene. You're going to then put on your gown, your mask or respirator, your goggles or your face shield, and then your gloves. Okay. So it kind of goes from uh, clean to contaminated progression. And that's because gloves is last, and that tends to be the highest contamination. And you'll see that later. So why does the order of dawning, why does it even matter, right? So, but you have to think about contamination flow. The gown goes first because it protects the uniform and your skin. The mask goes on before the gloves because your hands are still clean while adjusting it. Then the goggles or the face shield goes on to protect the mucous membranes of the eyes. And the gloves actually go last because once gloves are on, they become the most contaminated item in your PPE sequence. And so let's look at how infections enter, right? So the eyes, the nose, the mouth are major portals of entry for microorganisms. And this is important because mucous membranes are moist. It's moist tissues, and microorganisms love moist surfaces. So they attach themselves to them. And that could be by, you're looking at respiratory viruses, droplets, contaminated fluids, and these things can enter the body through these areas, the eyes, the nose, and the mouth. So, when you really think about it, if you put your gloves on first and then adjust your mask, you've contaminated your face. So that's why order matters. So let's look at a question. So our next question is, the nurse applies PPE before entering an isolation room. Which action requires intervention? So applying the gown first, applying gloves before adjusting the mask, securing the respirator before entering, and or applying eye protection after the mask. Okay, let's see what the answer is. The answer is B. Gloves should not go on before adjusting the mask. And why? It's because gloves become contaminated quickly. And touching the face with contaminated gloves creates self-contamination. It increases your self-contamination risk. So this is how healthcare workers really accidentally spread organisms, to their nose, to their mouth, to the eyes, and then actually to surrounding surfaces. Now let's move on to doffing. Okay, first donning, we put it on. So doffing means removing. And this is where students kind of struggle. They struggle, I don't want to say most, but they struggle with the doffing sequence because removing PPE incorrectly can cause major contamination. You know, think of it as the outside of the PPE is contaminated. And so that means every movement in the doffing sequence matters. So first, you're going to take off the gloves, okay? And then you're going to remove the face shield, then the gown, then the mask or respirator, and then after, perform hand hygiene. And remember, the outside of the PPE is the most contaminated. So why do the gloves come off first? Like we've said, like I said, the gloves usually contain the highest amount of contamination. So you want to get those off first because they have touched everything. They've touched the patient, they've touched the bed rails, equipment, body fluid, contaminated surfaces. So you want to take those gloves off, excuse me, first. You know, when removing gloves incorrectly, ooh, excuse me, if you remove gloves incorrectly, microorganisms can transfer directly onto your hand. You got all that contamination on the gloves. You remove the gloves incorrectly, and now you contaminate your hands. And so, if you don't do anything about it, you're going to contaminate everything else. And that's why glove removal technique really matters. So, on this slide, you can see where, the nurse has both of their gloves on. So they take one gloved hand and goes in the inside of the other glove and pulls it. So it pulls not the inside, but the outside, like that little, uh, they kind of create like a little cuff, but they kind of grab it and then they pull it over the hand. And then you'll see a lot of times they'll take that dirty glove and kind of put it inside and make a fist with the other hand. Then they'll take now the glove without the hand without the glove, They'll take a finger and put it inside of the glove. That's where it's clean because that's your skin. And then they'll pull it off. Okay. And then once they pull it off, the other dirty glove is in the inside of the glove they just removed. So remember, when you pull it off, the glove that was next to your skin is actually the cleanest because it is inside of the glove. Hopefully that makes sense. Yeah, it sounds confusing, but when you perform the action, you'll see what I mean. Okay. And if you remove the gloves correctly, like I said, it really prevents you contaminating, getting your hands contaminated, and then contaminating the area. So next, why does the mask come off last? Okay. So the mask protects the respiratory tract. And you remove it last because, after you're doing stuff and you're performing your duties, there may be airborne particles that are still in the environment. And so you want to keep that on last because you want to, protect your airway. Okay. So that's the reason for that. Now let's look at another question. So after exiting the patient room, which action requires intervention? So it's A, removing the gloves first, B, touching the front of the mask during removal, C, performing hand hygiene after the PPE removal, or D, rolling the gown inward during removal. And if you selected B, that was right because the front of the mask is contaminated. And this is really important. Respiratory droplets land on the outside of the mask surface. And, you've taken off your gloves and then you touch the mask, you have transferred the organisms that was on the mask now to your hand. And so then the contamination can spread. Like we talked about, to the phone, to the keyboard, when you're documenting your notes, to the charts, even to your own face. You may rub your face and now you've contaminated your face. You know, so that's why it's so important not to touch the outside of the mask with your hands. And the answer about rolling the gown inward, it traps the contamination inside the gown, and which will, ultimately uh, reduce the environmental spread of any microorganisms. So let's look at hand hygiene. All righty. So they say hand hygiene saves lives, right? So, and you may know this, you're going to hear it a lot. Hand hygiene is one of the most effective infection prevention measures in healthcare, hands down. Hands constantly touch surfaces. And microorganisms, as we're learning, they're on surfaces and they can transfer easily through touch. And then think about it. Healthcare workers with their equipment, think about those Dynamaps and, their stethoscopes, they move from room to room. And so without proper hand hygiene, the nurse, the nursing student, the healthcare professional becomes a transmission pathway. So, in order to protect our patients, we need to perform a lot of hand hygiene. And so, how do we do this? What are we doing when we're talking about hand hygiene? We are talking about soap and water or alcohol sanitizer. Okay, this is highly tested. I guess a lot of things are highly tested, but this is highly tested because you need to know which can kill certain microorganisms. All right. So when you're using the alcohol sanitizer, it's good for routine bacteria. You're kind of getting off the routine bacteria. At many hospitals, before you enter the patient room, you're putting that hand sanitizer on before you enter in the room. It kills many viruses and it's a quick decontamination. All right, it's quick. You can go in, as you come into the room, after you finish your procedure, you wash your hands with soap and water. You go out and you use the hand sanitizer again. You just want to make sure that you remove as many microorganisms as you can out of the healthcare environment. Now, soap and water. Soap and water is uh, best for visible, soiling on your hands. Okay. It is best for C. difficile because remember, C. difficile loves, the healthcare environment, and soap and water is the most effective way of removing it and preventing the spread throughout the hospitals. And also, soap and water is good because of removing spores like C. diff because you're washing them away. Okay, so remember that. And so, since we're talking about hand washing, C. diff is normally tested. Uh, it's one of the things you will hear about in nursing school. You know, C. diff is so important to know about because C. diff creates spores, and the spores develop this outer protective coating that alcohol cannot penetrate. It does not destroy them at all. And so you're going to have to use soap and water to physically remove the spores from the skin because C. diff, when C. diff runs rapid throughout the hospital, it's because somebody did some poor hand hygiene. Remember that. Okay, here we have another question. So the nurse cares for a patient with C. difficile. Which action is most appropriate after glove removal? A, using alcohol sanitizer only. B, washing hands with soap and water. C, applying lotion immediately. Or D, double glove before leaving the room. And if you answered B, great. Like we talked about, soap and water physically removes spores. This is not just memorization. This is microbiology. This is something that you need to know. Spores, like I said before, are resistant to alcohol sanitizer. And that's why, like I said, when a hospital has a C. diff outbreak, it's because the nurse or whomever had some poor hand washing. Because if they wash their hands, the C. diff infection would not get out of control. Remember that. Remember that, because you're going to come across some C. diff at least once in your nursing career. Okay. I have a prioritization NCLEX question and PPE. So let's look at it. So you have the nurse. So the nurse must see four patients. Which patient should the nurse see first? So you have the patient with MRSA needing pain medicine. B, the patient with influenza that's coughing without a mask. C, the patient with C. diff requesting water. Or D, the patient with VRE asking to use the restroom. And if you answered B again, you are correct. You know, um, the patient with the influenza and the coughing without a mask, that presents an immediate, uncontrolled respiratory transmission risk. Remember, the patient is coughing, and that coughing and those microorganisms can infect staff, visitors, and patients really rapidly. The NCLEX focuses on immediate safety threats. So they also, focus on uncontrolled spread or airway and breathing risk, and population exposure. So it's good to kind of remember, what the NCLEX is really focused on because they really want to know if you are a safe and competent nurse. Okay, I know I know a lot is on this slide. So, but this is a quick, kind of a quick review, when you're donning your PPE, so that's putting it on, you want to hand wash first, do that hand hygiene. You want to put on that gown, the mask, the goggles, and the gloves last. When you're doffing and removing the PPE, you're going to take off the gloves, then the goggles, then the gown, then the mask, and then you're going to perform hand hygiene. On this chart, I have, some items. So gloves, of course, like we talked about, it has the highest risk of contamination. You want to remove those first. The mask and the gown, we talked about the outside of the PPE, it is contaminated. You never want to touch the mask and you want to roll your gown inward to reduce the exposure to the environment. And then the hands, we all know it is a major spreader and we really need to wash our hands frequently. You know, you need to remember that dirty touches dirty, clean touches clean. Um, like I just said, the front of the PPE is contaminated. You have to remember that. You want to remove your gloves first. You want to remove your mask last. C. diff, if a patient has C. diff, you want to do soap and water only. And like I said, the gloves are the most contaminated item of your PPE. And so, if this video kind of helps you understand PPE and helps you, help kind of make it make sense, please subscribe to Nurse Ed Scholar, because I'm really trying to build a really strong clinical judgment and NCLEX teaching library on YouTube. That is really what I'm trying to do. And really remember, great nurses, they don't simply just memorize. They don't simply memorize steps. You know, like pertaining to this video, great nurses really understand contamination, transmission, and patient safety. Because that understanding is what helps you answer difficult NCLEX questions, even when the wording changes. A lot of students say, well, my questions in class wasn't like the questions in, whatever resource or the book. But if you truly understand the concept, um, the wording can change. You'll still know the answer. Okay. And so I'll see you in the next lesson and happy studying from Nurse Ed Scholar.